Welcome to the Educate and Empower podcast, where we educate the community around healthcare and a healthy lifestyle. Hi everyone, welcome to the Educate and Empower podcast, brought to you by the Holistic Care Collective. I'm your host, Rebecca East, or Bec. I am a nurse practitioner. I am the CEO and founder of the Holistic Care Collective, and I'm so pumped to be bringing my first episode to you today. To get things started, I decided that I needed a good friend to break down the walls about who I am and what I do, and no other than Jace is here to join me tonight. Thank you so much for joining me, Jace.
Thanks for having me, Bec. I am so bloody excited for this podcast to come together and obviously to help educate and empower people in the community about their health and well-being.
Absolutely.
So,
Thank you.
if you're ready, let's get straight into the questions that I've put together for you.
Be kind to me.
I'll do my best. First up, I think let's just tell everybody who's watching, listening along, a bit more about you. Who is the real Bec behind the scrubs and the stethoscope?
Absolutely. So born and bred in Rushworth, regional Victoria, on a sheep and cropping farm. My dad was a shearer and my mum was a stay-at-home mum. I'm the oldest of four, so I was kind of mum's right-hand woman while dad was out on the farm. But I was very not far from dad either. So I love farm. I still, my last goal for my kind of world right now is actually to purchase my next farm for myself and my family. Yeah. So that if I can do that, I think I will be the happiest woman in my world. But so I love farm life. Very, very passionate about regional and rural, remote, obviously healthcare. So yeah, I grew up over there. Went to school locally, and then I don't know whether you do the typical country girl thing, but I packed up and headed to the city, but it wasn't the big city. It was Geelong. I was really keen to head to Geelong to learn to surf, which I did while I was studying my nursing. I actually originally wanted to do forensic science. Because I love anatomy, and some of my favourite pastimes with my dad, or memories with my dad, is actually watching all the forensic shows.
I was going to say, is this born out of Criminal Minds or something?
Absolutely. I love anatomy, and I think particularly, the human body, and I think that's why I love surgery now too, is because I get to do that kind of stuff nearly every week. So so that's me. I then met my husband or boyfriend at the time, now husband, and we got married. Ash and I got married a few years later. And I have now two beautiful children, Harriet, who's 14, and Alfred, who is 6, nearly 7. And we live locally in Rochester now. And I have I'm the owner and founder and everything of the Holistic Care Collective, which has been a massive dream of mine is now why I'm doing the podcast, because that's part of the company as well.
It's part of the company. So for those who aren't already aware, they will be soon.
Yes.
But what is the... Sorry. See? Fucked it. I was about to say the Holistic Healthcare Collective.
Right. That's better.
Okay. So for people who don't already know, which they will soon, what is the Holistic Care Collective?
Yeah, so the Holistic Care Collective is a nurse practitioner-led health and wellbeing company. We're not just a clinic anymore, we're a company. We have multiple pockets of health and wellbeing products, services, and as I said, my biggest undertaking was taking over a eight-room medical clinic in the middle of Echuca, out of a very big leap of faith, and actually only 12 months ago. So we now are tenanted by some of my staff and nursing and allied health practitioners, along with subtenanted by other like-minded allied health and medical and surgical practitioners that come and visit. So Holistic Care Collective, is that big company now. And then we own the THCC Collective Clinic, and we also now have our podcast me, events, and yeah, what else more? I'm sure there'll be lots more. I
There'll be so many more amazing things, I'm sure.
can't.
So, also maybe dive into like what motivated you to start THCC.
I, along my nursing career, and during particularly my journey towards my nurse practitioner masters, which I'm sure we'll probably talk about at some stage during this podcast. But during after my nurse practitioner, I very much aligned with working within a surgical clinic or a multidisciplinary clinic. I was never seen to be autonomous, and um, I did my nurse practitioner masters to be allowed to autonomously practice whatever I believed the patient was in front of me, and so I guess the THCC was developed so that I could actually grow that. But I'm really passionate about holistic care and nursing and care being delivered in the appropriate way, medically based, but looking at the whole person, not just the ailment that I see in front of you, like your knee replacement. There's so much more to someone who's not gone through a knee replacement than just their scar or their wound or the fact that they've got pain. There's a multitude of factors that contribute to their recovery. So that's only one element. But yeah, I guess also as a woman who's been through through the journey of infertility and struggling to fall pregnant and things, I really found that there was nowhere I could go that was that space where I could be managed collectively. So
Yeah.
I would have surgery and then I would see the IVF specialist and then I would be trying to do acupuncture in one place and eating well and trying to lose weight by someone else. There was no core. Even my GP wasn't even necessarily discussed those management programs with me. And then as I've gone through the journey as a nurse practitioner, either just managing surgical patients or non-surgical patients, the patients want that. Like they want to
Yeah.
be managed collectively, and so to be able to have a core space, where that patient can walk in and be cared for with time, effort, less money, and actually walk out of here feeling like they've got a plan and it gets acted,
Yeah.
but in the one space. So it's a it's a multifactorial why THCC was developed, but I guess it's that personal professional growth. But yeah, there needs to be more nurse practitioners out there, and you know what I mean. Like I just, it's a beautiful role that unfortunately a lot of people, either nurses are aware of it and don't do it. But it's led me to be able to combine my two passions, which is healthcare and business, I guess.
Yeah. Yeah.
Yeah,
So we've kind of touched a bit on like the fact that you are a nurse practitioner, and maybe you've kind of alluded to, without explicitly saying, what a nurse practitioner can do, or why you've become a nurse practitioner. But for those who don't really know exactly what the difference is between maybe like a registered nurse and a nurse
yeah.
practitioner, can you just explain that for everybody?
Yeah, absolutely. And it's a really good question because I get asked a lot. I was a registered nurse. That's why I did my Bachelor of Nursing. And then I was able to, after several few years of what we call advanced practice or career years, I was able to apply for my nurse practitioner. A nurse practitioner is an autonomous, clinically led nurse that can make decisions just like my medical colleagues. So I can diagnose. So if I, run tests and work out, I can firstly run tests. I can run X-rays and do things like scan imaging and things like that. So I can request most of them. Some are not Medicare funded. Some are. We do blood tests, and I can then put all the pieces of the puzzle together, like your GP or surgical or what have you, and work out your diagnosis. So I would, work on diabetes or your obesity management or blood pressure or skin checks or anything like that. I would be able to determine what that complaint was and then create a treatment plan or an action plan for you. and I would
Yep.
treat you for that. So I can also prescribe medications. I'm not restricted in that. So, but I also in my career, so as a nurse practitioner, there's a lot of nurses who are actually in primary care, like as I was explaining about the GPs. But I also have, as a theatre nurse, trained theatre nurse, I had the surgical assisting. I have the surgical skills, so I understand surgery very well. So I've got that balance between medical and surgically really, really well
Yep.
on. So yeah, I don't need a referral to be seen like any GP does. And but I do tend to stay in my niche. So a lot of nurse practitioners, they're in primary care or they're actually really quite specialised. So I
Yep.
do have my set specialties, but there's actually now pretty much not much that I don't do. But yeah, that's really what a nurse
Brilliant.
does. That's good.
I think that was great. Yeah. Yeah. I mean, people can ask questions afterwards, can't they?
100%.
Get on the socials, ask the questions.
Exactly.
Um, so I guess, like, as a nurse practitioner, I feel like, I don't know, maybe correct me if I'm wrong, but for me, I feel like it's a bit of like an emerging kind of role in the health industry, especially in Australia. And I'm like, I fully believe it's much needed. But because it is like, let's say emerging, because it's not necessarily new, but maybe emerging, um, you would come across so many different misconceptions about like what you actually do.
Mm.
Uh, and I'm just wondering, like, how do you address those?
Yeah. I think it's about communication and education. And I guess that's also part of the reason why I want the podcast is to help break down those barriers of access to nurse practitioners and also encouraging um,
Yeah.
registered nurses to actually explore the role. But it is just about it's about breaking those barriers and the walls, both at a local level. So me having the conversation to the community and to the patients. The patients subsequently talk to their colleagues and relatives and all of that. Um, and then it's at government level. It's which the Australian College of Nurse Practitioners are doing a phenomenal job at trying to uh, escalate and, as you say, bring nurse practitioners to the table. They believe that nurse practitioner roles could be really managing a lot of the GP shortages within our communities, especially regional and remote. We know here in Echuca we're looking at a 4 to 6 week wait for your normal
Mm-hmm.
appointment. So, seeing someone like me for the specialties that I work in does, take that back. So, I think to really help is about communicating and just educating and continuing to encourage the discussions at your dinner table, but at the political table as well.
Yeah, exactly. From the dining room table to Parliament
Yeah,
House. I love it.
and all the way through.
Exactly, and all the way through. I'm gonna like switch it up a little bit and maybe like take us a bit more on like a personal side of your journey as a nurse and a nurse practitioner.
Yep.
Um, Starting off with something like I guess probably really positive, which is like if you can share some highlights or like big moments from your career in the healthcare field so far.
Yeah. Oh, there's too many, really, and not being egotistical at all. But have had a really, really blessed a journey in the health industry. I very early in my career, I actually joined the Australian College of Operating Room at the time. It was Operating Room Nurses Board, so I was a director. Actually started as an observer and then went as a director, subsequently was elected president, and then I was CEO for that company for 4 years. So that, like, all of that highlight was phenomenal and really gave me a huge opportunity at, as I say, at the political level, but not just locally, but nationally, internationally as well. Um, as I said, I'm a theatre nurse by trade, so being able to influence standards, operating room standards, not only nationally but internationally in Papua New Guinea and
Mm.
Fiji and things, it that's a phenomenal. That I think that's been one of my massive highlights is to be part of that journey, and So yeah, that traveling the world and being able to influence operating room nursing standards was pretty special. Um, I think for me personally, just doing my master or my double masters in 3 years with an incredibly supportive husband who did travel in interstate a little bit, well, mainly locally, but he was not really home very often in truck driving business, and Harriet being one. Um, like that's been that was a phenomenal achievement. I kind of don't think I've really acknowledged how tough that was. Plus, I was working part time at the local hospital and being
Jesus.
full. Yeah, I know. And everyone's like, "How did you do it?" And I
Literally.
just literally just did it. I didn't really question it because I loved it, and I was doing the acorn
Yeah.
work as well. And so I don't think that in it, like I've never really acknowledged just that element that I did my nurse practitioner. And um, after that, I actually thought of doing medicine, but I decided not because I like my nursing kind of background and way of approaching things rather than. So I think some of those have been, yeah, some of my massive highlights. Sure,
Yeah.
there's, yeah, more.
I'm sure there's plenty
Yeah,
more, but like that gives a really nice snapshot of just like some of the incredible stuff you've been able to
yeah,
achieve. We sort of touched on this with like the doing the double masters, being a mum,
mm,
and also working part time, and also sometimes being on call.
mm,
Very busy, very hectic. For you, how have you been able to maintain work life balance?
yeah.
Or sometimes, like, I don't know, you might be able to be really radically honest with us and go, I haven't always, and this is how I got it back on
Yeah,
track.
absolutely. No, I haven't. Never done it. I was more organised back then. I don't know what happened. I don't know. I honestly don't think I've ever gotten it right. My kids, like, I might get emotional here, but so especially Harriet, she really sacrificed a lot while I was doing a lot of travel with Acorn, and then building my business, and especially building into nurse practitioner and getting these skills that I needed. Um, there was late nights. I still remember
Mm,
operating for about 19 hours straight. We did. So you don't get a balance. My darling husband gets a phone call. Literally, I still remember the nurses ringing him, and I could hear him. I'm like, I'm stuck in this surgery. I can't get the kids, and I knew he wasn't going to be able to make it, but he could just do it. So those moments are really tough, but that's I guess the sacrifice we've all made in terms of they know that at that time the patient does need to go first, and of course I
yeah.
can't just deglove and say, see guys, I've got to
See ya.
back up. So I think being really transparent with the kids during that journey is really important. And Ash, as I said, has been remarkably supportive, and he's really had to step up like all the other husbands do for some nurses as well, but nursing wives as well. But you don't get a balance, and I get a lot of questions about how do you do it, Beck? And there's some days
Mm,
that I don't do it. There's been days where I've missed Harriet's um, dancing concert, or I've not been able to go to her award ceremony because I was scrubbed or I got
yeah.
delayed. So I think I started, and I don't have a clean house all the time. Now I have a cleaner. Like, do you know those things you just
Yeah.
to prioritize? But certainly in the last couple of years of my career, I've really had to put boundaries up.
Yeah.
And there are some yeses. That's hard. Yes, I will not miss that. And then there's other days that I'm gonna have to go. That's it. But I have a little bit more flexibility now in terms of managing my diary and things like that. So, and I'm not jet setting all across the world at the moment. Anyway, maybe
Yeah.
later and down.
Maybe. Maybe.
Mm. So yeah, for anyone, I don't know, I may look put together, but I'm not always, and you shouldn't expect to. And that's the same as what I would say to a patient in front of me who was struggling with managing their own health. We don't get it right. It's not an all or nothing. It's just is ebbs and flows.
Yeah, I think it's like, I mean, for me, it's like a work in progress, right?
Absolutely.
And I think it's like, and my idea of work life balance for me right now would be completely different to yours.
Yeah.
and will be completely different to me in 30 years' time.
Yeah,
You know what I
absolutely.
mean? Like, I'm like 30 years' time, I'm living in Bali, right?
Yeah,
That's my work life
that's
balance.
exactly right. But I think
It's like work down here, life up here, right?
absolutely, absolutely. I think you just choose your heart. I think, and
Yeah.
yeah, yeah it. Some days it is what it is, and then other days you can smash it, and you feel like you've done amazing job. So yeah,
And for you, you've carved out like a area of healthcare and your life and in an industry that you're like incredibly passionate about. So when it is hard, long hours, you're like, it's less
yeah,
hard than if you were doing something you hated, right?
100%,
So
absolutely,
yeah,
absolutely.
love it, love it. I'm really interested to hear from you because you've been in the industry. Oh, how long
20
is it
odd
now?
years.
20 odd years. Yeah, cool.
Yeah.
How has your perspective on healthcare evolved over like the last 20 years? And also, are there changes that you'd like to see in the industry?
Oh, you know the answer to that.
I'm like, I know that there will be.
Oh, look, the health industry is it's an interesting journey. I certainly, especially nursing. I'm going to focus probably on the nursing industry. You know, university nursing. It sounds really ridiculous, and I feel really old for saying this, but university nursing actually wasn't really that new. It was quite new when and so, with anything in the healthcare industry, and I was only talking to a patient the other day about some options, and I said, the pendulum swings, and we all think that this is the wonderful time, and then there's great treatment, and then we go back, and it's like HRT, I guess. And then we go, oh no, you're not allowed to use HRT because it'll give you breast cancer. And now it's kind of in the middle. It's like, well, yes, it gives you, there's some risks, but there's some benefits too. So sit in the middle and work out what's best for the patient. And it's
Yeah.
exactly the same thing for anything in the healthcare industry, and particularly nursing. We went from all college, no college, to all on the job training, and then we've gone from all university training, and then we're kind of stuck in this middle ground. And whether that's right or wrong, I don't know. I think that the nursing industry now is really bleeding. It's really quite
Mm.
sad. It's really tough for the guys out there, and probably part of the reason why I decided that I was gonna get out in terms of the everyday general nursing, because
Yeah.
there's no way I would be able to function as a mum that I wanted to show up as and do the things that I wanted to do in my career. Um, whether I was doing night shift in theatre, doing trauma every night, like that just wouldn't have worked.
Mm.
So I think, I think the nursing industry itself is really in a bit of a pickle, and it's really quite sad. I know the government are doing. I've got contacts. I've been talking to them, but 75,000 nurses left the industry just last year alone. That's massive. I think there's
Terrifying.
yeah, it is. But I think some of them are really diversifying the role. And I was only talking to Melissa today about, the plans for the business. And a lot of things, nurses can do a lot of things within the industry. They're just not utilized in the correct way. So I think by, showing up to a 7A, and that might work for someone. Don't get me wrong. Some
Yeah.
enrolled nurses might want to do that flexible, and that they get the kicks out of that. That's great. But I think there's a pay issue. There's the time issue. There's a family
Mm.
friendly issue, because I think the last stats that I heard were about 94% of nurses are actually female. So it's a huge cohort. You think then
Wow.
how many of them do have children? Um, so yeah, I think I don't know. I don't know what well, no, I don't really know what the answer is. I do know what the answer is to shortages within the GP sector, but I've already touched on that. And I think, a collaboration between general practitioners and nurse practitioners is really necessary, and
Yep.
especially regional rural area. We also, our industry has gone nuts in terms of AI and robotics. Absolutely nuts. But the industry can't catch up because we haven't got enough staff. But and our skills are not up. Our staff are not upskilled to be able to use it. So,
Yeah.
even a robotic surgery. I was listening to a conference. I was at a conference in Queensland last year. The year before. It was last year, and a robotic heminephrectomy, which is where they move part of the liver, kidney, one of the
Yep.
kidneys, was like a robotic one still takes 8 hours, whereas actually if you opened the patient up and did it openly, it actually takes, or laparoscopically, it takes you half the time. Um,
Yeah. Wow.
yeah, but that's mainly because it's setup of the actual robot. It's not not actually the
Right.
procedure itself. So I just think there's a real disconnect with uh, the industry itself and the training process for that. And then we've got all this incredible AI and technology that's gone skyrocketed, but nothing's meeting in the middle. So I also think that you 100% can't replace nursing and nursing care by a robot or an AI. The patient still needs and deserves that handhold before they go to sleep in an anesthetic, or when they're passing away, you don't need a little machine to tell you that it's like you need connection and care. And I guess that's why I'm so passionate about continuing to wave the flag for nursing, because we are so pivotal
Yeah.
in a patient's journey.
All right, we've touched on some of like the really positive and highlights of your career, but for you, what are some of the biggest challenges that you faced in your career, and how have you overcome them?
Uh, I think it's been trying to advance my career, um, with a family, and also embrace the nurse practitioner role without people being aware of the role itself. So I guess it's been a challenge, yes, as like, there's things that I really want to get done, but my kids have to come first, and of course that's the way it is, and I don't want anyone judging me because I'm not doing that. But um, I think it was a real challenge to be able to kind of um, I have a lot of people say, "Oh, but shouldn't you be home with the kids?" Or, "Oh, why are you, where are you today?" Or, "Oh, you don't." So a lot of that misconception that about my role, both
Yep.
personally and professionally, I think was, and just trying to navigate the career that I was having, especially with my Acorn role, like that was. Especially in COVID, I was trying to homeschool and have government meetings with, the chief health officer dealing with COVID and how we're going to manage surgical cases. And here's Freddie, who was like 3 years old, coming into my webinars. Now, we all got so much relaxed about that, but here I am having my star moment in the, COVID issues, and dealing with the direct health minister, and I've got a 3-year old in the background, like that.
Yeah.
But I've learned to embrace that, and a lot of people now, sometimes the kids will be here in the clinic. Of course, they won't see it in the consulting space, but if Harriet's answering the phone or something,
Yeah.
that's just the way school holidays
Just like,
bring
mum's
on.
busy.
I am. Um, yeah, exactly, exactly. Yeah, absolutely. Oh, and I have to pay her too, so don't worry. But I think just that personal, professional management while I was trying to build a family has been challenging, but very rewarding at the same time. And I think then just seriously, the whole challenge of what a nurse practitioner does, why are you doing it? Why are you allowed to prescribe, or why have you got to have collaborative arrangements? All of these things, it's just, and you do such hard work to be able to be deemed, safe and efficient. And as I said, we are really fixing gaps within the healthcare industry. So why are we not allowed to? So I think that in itself, and I think also just one last challenge is actually been
Yeah.
about my own
Right.
imposter syndrome
Yep.
and my confidence, and that the I used to say I'm just a little country girl from Rushworth. I really achieved much, or I don't necessarily deserve to continue to do what I actually, you and I know what big dreams I have. And I didn't never believe that I could do what I'm doing now, which is starting my own podcast and have my own
Yeah.
health and wellbeing clinic and or company now, right? But I think that's been probably actually my own self has
Yeah.
been the biggest challenge,
Yep. And how do you
whole
overcome that?
journey. Yeah, lots of self development. lots of support. Like I absolutely would. I still go home now, especially during the opportunities where I was given with Acorn, and then through my nurse practitioner like journey, I'd walk home and go, oh, I guess Ash, I kind of got to go to Nashville. Like, is that okay? And he'll be like, what? You're going to Nashville without me? Like, and he's like, yeah, of course. Like, you just take the opportunity. We've always, I've been given so many opportunities. So I think it's actually about leaning into, and having that support that if you're not going to barrack for yourself,
Yeah.
make sure someone else in your household is, because or that you've got someone, yeah, and a lot of self development.
Yeah.
I've really had to lean into that, and actually
Yeah.
work on myself, both, emotionally, physically, spiritually,
Love
holistically,
it.
actually.
Any chance to sneak that in there?
Yeah,
I feel like we've had a really good
absolutely.
chat about some of this stuff, but can you just maybe get a bit more specific with everybody here and let us know like the real areas
Yep.
of healthcare or like medical issues that patients might be facing that you're personally like quite passionate about?
Absolutely. So, my first very passion and I guess um, skills was all around orthopedics and sports injuries, and fracture management. So I had a lot of I was taught a lot by a wonderful couple of orthopedic surgeons, all about orthopedics, so bones and muscles, and hence the picture behind me. I love the musculoskeletal system. It's really, really cool. So that's that. So that's things like arthritis, sports injuries, injuries to any of your muscles, tendons,
Replacements?
rheumatoid arthritis.
Yeah.
Yep, joint replacements, absolutely. So the surgical management and the conservative management. So when I say that, which I guess I'll touch on in the perioperative space, but yeah, I know how to manage arthritis both within the community
Yeah, cool.
and then in surgery. And I can, because we try to avoid surgery, right? Like if you need it, you need it. But what we try and do is, if a 45-year-old patient presents to me with mild to moderate arthritis in her knee, but she also has a meniscus tear, which is a cartilage area of your bone, we want to delay that knee replacement as long as possible. But what we need to do is manage her symptoms and her pain and her movement, and basically things like that. So my role is beautiful because I get to do both. I get to manage and understand the surgical pathway, and I can manage you in the community for all of that. But I also can try and do the latter approach and not actually need you in the operating room, because we don't need it. If we
Yeah.
don't need an operation, why are we having them? So I guess, yeah, orthopedics and sports injuries are my jam. I've loved them. That's my background. But it's led me to, and then obviously perioperative. So I was a theatre nurse, perioperative nurse. Um, so I understand multiple surgeries. There's not actually, other than I never scrubbed for neuro, so I don't know
Yeah.
much neuro, but I love brain. It's weird. Um, I didn't do a lot of oncology. Well, I did a lot
Yep.
of general
Yep.
surgical cancer management. So I understand big surgeries for that, but I never really understood I never was taught the, I guess,
Yep.
community management of the cancer, but surgery, of course, I know. I understand the gut very well, because of my general surgical management. I do a lot of, so anything theatre involved, like anyone who's had theatre both pre-operatively, now as you know I surgically assist, so I help with some of the surgeons with the operations, and then I manage patients post-op. So all of that journey for
Yep.
any general specialty I can manage. um, then subsequently, when I was doing orthopedics, I then became quite interested in weight loss, because the most recent science says that if you lose 10% of your body weight, you're going to get a 30% benefit of your lower limbs in your joints. So actually, I've actually had quite success in removing a lot of patients' pain, and because of they've lost their 20 or 30 or even 15 kilos, so they don't actually have knee pain at all. I've got one lady who's lost 32 kilos, um, and is back playing tennis and has no pain in her knee whatsoever, but had seen a patient, orthopedic surgeon,
Wow.
because she thought she needed surgery because she was uncomfortable. So by managing your weight, and I'll come to that section in a minute, you can actually avoid
Mm.
surgery for your knee replacements and things. But it's actually really important to try and lose some weight if you're in a bigger category, because it's
Yeah.
actually then you recover better. Um, yeah, so you actually, yeah, you get a better outcome of your joint replacement if you're a
There you
little bit
go.
lighter on them, which makes sense. So then when I went into weight loss, I become very specialised in the three myriads of managing weight. So there's only three ways to lose weight in Australia, well, internationally really. One is via surgery. So I became a bariatric nurse practitioner very early in my career, worked with a bariatric surgeon. So I understand, again, the management within the community, and the patient journey. I have a nutrition background as well, so I can understand the food element to that. Um, so surgery for weight loss, I actually am one of the very few nurse practitioners in Australia who's undergone a scope program, which means that I'm a specialised weight loss specialist in this area. So I use a lot of
Yep.
pharmacotherapy, medication, to actually help lose weight. Um, and can't disclose what they are on here because it's breaking my APRA registration, but it is one way that I can do it. And then obviously diet and exercise alone, it's not as successful anymore, but it can be done. And because of my nutrition background and my musculoskeletal condition, I can kind of guide people on a lifestyle
Yep.
change that will help them lose weight. So weight loss, subsequently
Nah, that's
into
like, it's
technical
so
health.
good for everybody to
Um,
learn all your different interests and specializations and huge skill set.
because absolutely, because I was dealing with a lot of women with with weight loss. I actually then subsequently got really passionate, and because of my obviously my own personal journey, I got really passionate into women's health. So I've really started to extend my knowledge in women's health, and I do a lot of menopause management. I do fertility management. I do perimenopause management. I actually work with a IVF specialist and gynecologist who asks me to help patients with polycystic ovaries lose weight to optimize their health before they then go into. And so I created five babies, I think, last year, which is pretty exciting. I don't look after the babies. I'm not doing obstetrics. That's too that
Too
I
high
would not be able to
pressure,
cope with
like
that.
everything's
I'm really then
emotional.
yeah, absolutely. I would be sobbing on the floor with the mum. So, um, yeah, so that's women's health. There's not much I can't do in terms of management of a women's health management. What else? Oh, I did my diploma. I won a scholarship last year, and I look after a lot of wounds
Yep.
for plastic surgeons, so really complex wounds. And so the patients would keep asking me about whether I did skin checks, and so I ended up winning a scholarship to do my skin check. So I'm actually got a diploma of dermoscopy. But with my surgical skills, I can actually also do the biopsies and all the small excisions to remove the subsequent issues of the anyone after skin cancer. So I do that. We do iron infusions here as well because we have a lot of patients who tend to be iron deficient, particularly women in that a young age group who want to have babies or are not absorbing well, and also the
It's really
diabetes
interesting. I can kind
space.
of see like how the
We
cogs all
sell
like turn together, right?
100%, absolutely. So, um, I then obviously have products and things that are associated with the specialties that we do. Yeah, sports injuries and fracture management within the community. Wounds is obviously because I create them, I understand them, which is
I've
gross, I
never heard
know,
of
but
anybody like phrase it that way
that's why.
before.
Well, I guess because I know the nature of how I've made the incisions, and that subsequently, when you think about that, from especially the plastics and the complexity of plastics and especially skin cancers, it really helps with me to be able to manage them. But I'm also not fussy, and I don't need a lot of beautiful, very expensive. It's like the industry stuff, I don't need a very big, expensive dressing to manage someone
Yeah.
quite complex in the community. So I think that's in a nutshell. Not really sure.
I think you've nailed it, really.
Thank you.
I
Thank
think
you.
along with that, right, something I find really interesting, you sort of touched on it with the AI, is like all the advancements and changes that happen in the healthcare industry and how quickly it happens. I'm really interested to hear from you as a nurse practitioner how you stay up to date with all of those.
Yeah, it's pretty hard. Like it really is. I think probably more so I'm interested in I actually really like that kind of space as in like, oh, what's happened? Like I'm a bit of a nerd in that way. Like robotics was like, no way we can do this. Like this is really cool. And I used to love going through the trade at all the nursing conferences because there would be this incredible new, product. So, but it's really hard, and it's really hard for those. It's really hard to do education when you're registered nurse on the floor because there's only certainly many hours on the floor that you've really got to manage the patients, which is important. So it is really hard, but I think, I think we are adapting because we've had to adapt to within our personal life, right? Like, we don't meet and greet a lady at the checkout anymore. There's a self-serve checkout. Like, type of things have really defined me, but defined us and our community. But I do think as a business owner, I've had to as well. So, you have to keep up with things. So, yeah, I guess I'm a nerd around that. But, and I guess attending and being educated because I want to um, has allowed me to go, oh, there's a new dressing for that. Or, oh, did you hear, like, even I did this nerdy literature review on vitamin D and the dilemma of that when I was doing my skin check diploma. And I have a dilemma every day when I say to the orthopedic patient in front of me, now are you getting enough vitamin D? Please make sure you're exposed to the natural sunlight. We don't want to, if we have to, we can expose you to, we can give you vitamin D supplements, but it's much better in the sun. Because I am actually medically trained, but I love natural options of treating people. So, but then you don't want them to get skin cancer. So
Yeah.
it's an oxymoron. But like even doing that mini literature review of 1,500 words or something, the amount of information I learn about where vitamin D is going, and actually I just did one recently on vitamin C and where that's going to be able to, and even some of the weight loss medications now saying that there's a remarkable benefit not just on weight loss, but actually Alzheimer's disease and, cardiovascular, kind of
Yeah.
subsequently goes to cardiovascular disease anyway, but yeah, the Alzheimer's and the mental health stuff is phenomenal. So I think it's just
Yeah.
by keeping up to date,
It sounds like you just
which is
nerd
really
out over it though. So like that's what helps, right? Helps you stay up to date
nice.
is that you
Yeah. Yeah, but the more I know and the more I can tell, like if I can then go, hey, did you know that this literature says, because I've got to be based on literature, and of course that's what I want. But when I get a piece of literature that supports something that I know I can implement to my patients and make their lives better, bam, like what a winner.
yeah.
Like that's the best day of my life. Like, it's, yeah, but it is. I've got to be passionate about it. So I
Yeah.
keep really try
Yeah,
and keep
cool.
educated.
I think we've got time for a couple more questions. And I think the two that I sort of have been keeping in the back of my mind, maybe to leave right for the end, the juicy ones, is for you, what are your goals and aspirations moving forward for your career as a nurse practitioner?
Yeah. I guess I want THCC or the Holistic Care Collective company to continue to grow. I want it to be nurse practitioner and nurse led. So I really want to embrace that employment space where, nurses can see, I guess, an alternative to whatever else they're doing. You don't have to, caring for a patient can look very different. So I guess for me, it's about educating, empowering nurses to look at other avenues and certainly look at the nurse practitioner model because it's so goddamn fun. I love it. But 99% of the time, the nurses are saying they know. I knew that was what I knew how to treat these patients. I knew what was going on, and I wanted to be able to action it. And that was when it got started to get frustrated. So I was like, I'll go and do the nurse practitioner. So that's I guess, the company just to continue to grow and be very much around like-minded practitioners that I employ to help drive the core and values and that caring environment that I have. For me, it's about also stepping up and being that really, I guess, high-level CEO of a company that that changes the health industry, and changes the expectations of patients and their families. I want them to be able to, wow, like, God, I could have many facilities around the world, around Australia and the world, about where they literally, as I say, like everyone who comes here to our clinic here in Echuca, every single facility that is modelled on the same platform and modelled on those same values, and that patient is safe and cared for and they're consented, they understand what they're having done, and they don't leave until it's fixed, essentially. Um, and I think then for me, it's just about, getting that farm and spending that time with my kids, and giving them the life that I had, and the opportunities that I had. Because, my mum and dad worked remarkably hard to support me, and mum, was very pivotal in, encouraging me to get out and explore the world and see where it takes me. So by doing that for myself and my kids, and giving me that farm life that is the oasis, as I said, you don't find that balance. But by Jingoes, when I used to drive down we used to lease a farm a few years ago. Every time I used to drive down that driveway, I'd be able to switch off, and I really miss it. So be able to have a farm that I can call my own is the last piece of the puzzle. And then I think it's just what this podcast is, my slogan or my title: educate and empower. Educate and empower the community
Yeah.
to actually ask the question and to seek a second opinion. It doesn't have to be mine. I always say that to my patients. Like, if you're not happy with what I'm providing you, or please, like, you need to do what's right for you. But ask the questions, demand for good health. I've been on many bedsides of family members, asking the questions, and some of them that hasn't come well received, but you deserve to be well treated and well cared, and it doesn't matter who you are, or what you're doing, or what your journey is. So it's about educating in the right in about the right way of treating, and what's right for you. I always quite often see a lot of patients that actually present and go, "I think I've got a skin cancer here."
Yeah.
Well, they're 99% right. Like, you know, the ladies will come and see me and go, I think I'm in menopause. Yeah, you are. Like,
Yeah.
yeah, let's treat it. Like, I think just educating, empowering people to actually access healthcare. Don't be scared of it. Knock doors down if you're uncertain, and follow your gut instinct is what the ultimate goal would be. If we have many people out there in the community banging that broomstick on the ground and saying, no,
Yeah.
that's not right, then I've actually achieved
Yeah. There you
the
go.
biggest dream.
My last question is probably the juiciest. It stems from what you've just been speaking about, right? About like patients advocating for themselves, um, trusting their gut more, getting that second opinion. But have you ever had to be the person, and I'm assuming the answer is yes, and maybe you've got a story that you could tell us, de-identified of course, but have you ever had to be the person to sort of break down the doors and advocate for the patients? Mm.
Yeah, regularly. Regularly. One really does come to mind. He was a very complex wound patient of mine who was a melanoma on his scalp. He was having regular dressings, and things just weren't progressing. He was palliative, so we were aware that he was palliative. But his wound was just really quite complex. And so the surgeon rang me and said, "Look, I really need for you to be able to step in with this one. Can you see this patient and manage him ongoing?" And I did. And I saw him regularly and we managed his wound. But no one had actually thought he was really struggling with pain. He was an elderly man with rheumatoid arthritis. No one had thought to reinstate his rheumatoid arthritis pain relief. And so the reason was because um, some of the medications can delay healing. Now, this man was palliative. He's still alive and very well, but he was palliative. So we couldn't fix the wound on his skull. and we couldn't really repair. It was just a matter of time. So for me to then ring the surgeon and say, actually, why the heck has this methotrexate not been started, and why is this pain relief not being started? It actually goes, thanks for giving me the heads up, because I actually never thought of it. I said, so we can start it? He goes, yeah, absolutely. So the man the following week walked into my office, not a wheelie frame, not a creep or a crawl or a wince when he sat down, because he started his medication. It's just one of those things where you don't think it, we have to think outside the box, right? You don't need to think about the fact that we don't want him, we know he's not going to heal, but we need to keep him comfortable. And the pain from the rheumatoid arthritis wasn't killing more
Yeah.
than his wound was. So I guess, yeah, there are lots, or there's many a times where I ring the orthopedic surgeons in Bendigo and I say, this man, he ain't going to be waiting 3 months.
Yeah.
We need him done now. And they will
I
be
think that's such a good
100%.
message as
Um,
well. And it's like
but
a
I've
really
done,
nice story because you have advocated, maybe you felt like it might have been nerve wracking a little bit to pick up the phone to the surgeon the first time you did it. But then for them to turn around and just be like, wow, yeah, thanks, like, good catch, well done. And like to reinforce the fact that actually, like, everyone's a
yeah,
team. Like, if you're all working, whether you know that you're all working together with a single patient, like, I think it is that, like, everyone's a team. And like, as a team, good team members sometimes pull each other up, ask the questions, support each other. Like, that's a form of supporting each other, isn't it? Like,
100%, absolutely. And surgeons are surgeons. They are bred and born to actually operate. So to think outside the box, it's very difficult for them. So for me to be, yeah, for me to be able to just ring and say, hey, why are we not doing this? And he go, oh, of course. Thank you. It doesn't have to be
yeah,
negative. It can be really positive outcome. And we are all a team, but we all can't be here, there, and everywhere, and
yeah,
eyes and ears on everything. Like, you know,
yeah, exactly.
we're only
Exactly.
human.
All right. I think that's a really good spot to leave
100%.
it. On a nice positive note there. It's beautiful. Hopefully, hopefully everybody's loved
Absolutely.
getting to know you. I've loved being your co-host, I guess we'd call it,
Yeah.
asking you the questions, fishing out the juiciness out. But yeah, I'll hand back over to you to finish us up.
Jace, thank you so much. I can't believe that we've finished our first episode. Amazing. Thank you so much for joining me today. As I said, this is a really big dream of mine, so really excited. If you have really enjoyed tonight's episode, please like, share, and follow us on Instagram, Facebook, TikTok, all the things. This will be recorded too, so jump on and follow us on our YouTube channel. Snippets will be thrown across to our social media as well. But yeah, Jace, thank you so much for today, and everyone stay safe and take care.
Bye.
Bye.